Hello, and a very warm welcome to all of you. For those of you that I haven't met, my name is Patrick Watt, and I'm the Commercial Director of Bupa Global and today's host in our newest series, Perspectives. These events are exclusively for our intermediary partners all around the world. The success of all our business relies on you, and we hope that this will be a real moment to change the way that we engage with you and demonstrate our commitment to grow and strengthen our relationship. Our aim is that this series will be a genuinely insightful, providing us with opportunities to work together as part of one global community. Only by learning from each other, we can better prepare for what is coming next in this new reality. Today, we have a truly global audience, and it's great to see so many of you dialing in from so many parts of the world. So whether it's good morning, good afternoon, or good evening, I'm delighted that you can join us today. As we start out, we'll be using these events to update you about the coronavirus pandemic, how it's transforming the global healthcare landscape and impacting how we do business. But looking to the future and beyond the pandemic, Perspectives will evolve to explore much broader themes, convening thought leaders both within Bupa and externally to share the latest thoughts of what's going on around the world. But as for future events, back to today, we've got a great session planned for you. So before we get started, I have some housekeeping tips to ensure we all have as good an experience as possible. Firstly, the line is muted. So if you would like to ask a question at any point through the event, please type this in the Q&A functionality that's clearly marked with a question mark in the toolbar. Our events team will be monitoring the questions as they come in and will be answering questions at the end. Any questions that we don't have time for, we will follow up either on our new online portal or indeed through our account managers. We really value your time, so today's session is structured for 1 hour, and I promise to try and keep to that time. So the first in our series of updates is called Exploring Our New Reality. No matter where you are in the world, this virus has had a profound and lasting impact on all of us. Back in January, our world as we know it has been turned literally upside down. No one could have anticipated a new virus that would emerge that would bring so much of society to a standstill and put us all into lockdown. Today, 6 months on, and as the global economy begins its path to recovery, while we know so much more about this virus, there still remains so much uncertainty about the future. How and if it will evolve? Will it result in a second wave? Will a vaccine be found? All questions we'll seek to answer or address today. Indeed, the only thing that is certain is that no one is quite sure what will happen next. So whilst Bupa Global can't predict the future, it is now clear that COVID-19 has and will continue to lead to significant disruption in our industry and in the private healthcare sector. In the next hour, we will update you in the next stage of Bupa Global's response to the pandemic. We will share the latest clinical insights on the virus and the emerging trends, and how the outbreak is affecting our customers and demand for our products and services. We are all facing this new reality, so it's our job to help you and your clients prepare for it and come out stronger. Let me start by introducing our panel of experts. I'm really excited that we have a number of people across the Bupa organisation. Firstly, Sheldon Kenton, who I know many of you will know, CEO of Bupa Global and GeoBlue, who will first share a business update, including what we've been focused on and what our plans are for the future. We'll then go into 2 deep dives. The first, hosted by Dr. Paula Franklin, our Chief Medical Officer for the Bupa Group, who will share the most current clinical perspectives on the virus and how it's impacting different parts of society and different parts of the world. And then finally, Rebecca Kate Young, who's our Global Head of Operations, who will share insight from Bupa's own data about how this outbreak is affecting our customers and the demand for their services. But first, I'm delighted to hand over to Sheldon. Sheldon.
Thanks, Paddy. Hello, everyone. I think this is a nice forum for getting together, even though we can't physically meet at the moment. So thanks for joining us. I'm going to cover a few things in the next 5 to 10 minutes. I'll talk a bit about operational stability, so how Bupa Global responded to the immediate impact of the virus, what we're planning to do next, and then a short comment about what the future brings, and I'll try and wrap that all up in less than 10 minutes, so you get to hear the more interesting stuff that Paula and co will be talking about. So Firstly, I'm pleased to say that our business stood up well to the immediate challenges that the virus presented to us. As you all know, Bupa Global is a diverse organisation with many operations and offices across the world. And so, we really saw this coming in early January as it started to impact our business in China and Hong Kong. And, in some ways, although we didn't know what was coming, that did give us an excellent opportunity to road test what would then, in fact, become a global reaction to the pandemic as it spread east to west. So we had some advantages there, and I'm pleased to say that our business continuity plans, and I'm sure you all have these, we all look at them regularly and imagine we'll never have to use them. And, thankfully, the practice, the planning paid off well. We were able to get nearly all of our 3,000 Bupa Global teams out of their offices, but functioning well. And hopefully you've seen that, and we've certainly been grateful for the feedback that you've been giving us through this. Good, bad, and indifferent as well, actually. I mean, it was a once in a lifetime, at least I hope it's a once in a lifetime event. There is no rule book for this, but I was really proud of the way the Bupa Global teams responded. And of course, as the virus moved east to west, we became increasingly efficient at remote working. And the teams have done a fantastic job. So in terms of operational stability, and Rebecca will certainly say more about this, although we have seen a downturn in the short term in volumes, very happy with the service we've been able to deliver. Our NPS scores have continued to rise through this, and we feel very good that despite considerable disruption, we've been there for our customers. And at this point, I should also say how grateful we are to our intermediary partners. It really has been a partnership. Thank you for your advice, counsel, criticism when we haven't quite got it right, but also support in making sure that our customers' views are coming to us and we're able to act on them. So that's been fantastic. So talking about our customers, clearly having stabilised the operation and made sure that our staff and teams were safe, our priority then became our customers. And as you know, our customers are spread all around the world. With varying different circumstances, varying different products, and also, as it became apparent, pretty significant different access capabilities to care. And obviously at that point, it became our job to steer them through that. So we did a number of things immediately. We created what we called our COVID hub, which was essentially a digital repository of the latest and greatest thinking within Bupa Global, and also more widely within Bupa. So as you know, we're fortunate enough to be part of a group that has a considerable provision footprint as well. And those provision businesses were really at the sharp end of dealing with COVID-19. So we were able to crystallize a lot of thinking, a lot of support into the COVID hub. And many of you have been kind enough to give us some feedback on that. So that remains live and will continue to be live for the duration of this, and will contain what we consider to be the latest thinking and certainly the latest advice on accessing care, etc. Having rolled out global virtual care at the beginning of the year, we took the decision to quickly roll that out to every customer, irrespective of whether that was part of their product makeup at the beginning of this. Recognizing that virtual care was going to become an important part of this as we went through the worst parts of COVID-19. And we also extended mental health benefits across our entire portfolio, again, irrespective of what the customer bought at the time. And that's been pretty successful. And certainly for global virtual care, from January through May, we saw registrations increase on average of 49% a month. So, really strong evidence that customers were prepared very quickly to flip into virtual settings. And bear in mind, and Rebecca will cover some of this in her update, Bupa Global provides primary coverage in the world, in the parts of the world where we operate. So Bupa Global babies are still being born. Our cancers are still our customers are still wrestling with difficult conditions, and we continue to be there to support them through whichever medium is most appropriate for them. You probably know that we do have a general pandemic exclusion, and we took the decision very early on to waive that for this episode. So we were providing testing and coverage for COVID-19, and our teams dealt with significant and complex cases ranging from questions about where to get testing right through to some unfortunate customers who we had to support in intensive care settings in various parts of the world. So, that was real for our customers, and the benefit that we provided to them was real. And we assigned a case manager to every single case that was either COVID-19 or suspected of being COVID-19. Moving on to the issue of the general pandemic exclusion, that was something that we hadn't reviewed for a good number of years. And of course, in an environment where there is no pandemic, that wasn't particularly controversial. But we do recognise that became a sharp focus for you and for your customers. And so in addition to waiving the pandemic for COVID-19, we're also now moving quickly to remove the pandemic exclusion from our products. That's a relatively complex proposition within Bupa Global. Some of our products are delivered directly in the Bupa Global environment. Some of them are delivered through fronting partners, as you know. So as much as our intent is to remove that pandemic exclusion, we're in the process of consulting with partners. But our aim is to conclude that and to be able to communicate that to the market formally, and then move to adjust policy wordings, etc., so that we never have to find ourselves in the position of making a decision as a pandemic, epidemic or event embraces us. So you'll be hearing more about that as the year goes on, but it is our intent to remove that exclusion from all of our products as customers renew. And then finally, reflecting once again on our relationship with all of our intermediaries, we have had some feedback that perhaps we didn't come out to the market as quickly as possible in the early stages of this. I will say that was nothing to do with a desire or intent, but simply the massive organisational challenge of maintaining the Bupa Global operations running. But we do think the time is right to further engage with the market and more continually engage with the market. And as Paddy referenced earlier, today is the start of our renewed commitment to those regular market updates. I do think it's a time for us to come together. I think, for health in general and this pandemic in particular has focused the minds of our customers. And I'm sure there are product development opportunities and refinements. And we can really only make those in partnership with you, our intermediaries. So once again, thank you for your support during this. I genuinely hope you feel that we've reciprocated that and have responded well. I look forward to getting your feedback on that. But we're very grateful for your support. And I do want to make that point on behalf of everyone at Bupa Global. So thank you. And with that, Paddy, back to you.
Great. Thank you, Sheldon. I know there will be a lot of very happy salespeople knowing that we will now be lifting the pandemic. I think what makes it even interesting is that we've done that during the middle of a pandemic. So I know that's not a small feat. So I think that's really good news for our customers and hopefully our intermediary partners too. I think it's also interesting to note that whilst virtual care has been around in the market for a number of years, we have seen significant adoption. As you highlighted, we've seen month-on-month increases of 50%. And I think as we enter this new reality, more people, not just customers, but also providers, are seeing virtual care as a really effective way to deliver access to care. So it'll be interesting to see how those trends continue. One of the other things you said, Sheldon, was that feedback is really important. I know working with a number of you intermediaries that feedback is always forthcoming. So please take the opportunity to share your feedback. Just to remind you how you do that again, you will type that into the Q&A functionality, which is clearly marked with a question mark. So please do submit your questions. The events team are working behind the scenes, collating those questions together, and then we will pose them to our expert panel towards the end. As Sheldon says, the new reality means that there continues to be lots of uncertainty regarding how this virus is changing across society. And we're absolutely delighted to welcome Dr. Paula Franklin. Paula is Bupa Group's Chief Medical Officer, and I know has tremendous insight in terms of Bupa's perspective and understanding what's going on in the world. So it gives me great pleasure, Paula, to hand over to you now, and thank you for joining us this morning.
Thanks very much, Paddy. Thanks. I'm really pleased to be able to join you today. I am going to take you through an overview of some aspects of the COVID-19 pandemic and the approaches to managing it. Like the other presenters, I'm very happy to take your questions at the end. What I'm going to tell you is what I know to be the best current information. And as you'll appreciate, this is a continually changing situation. Our knowledge is evolving pretty much almost on a daily basis. And so this is something important to keep up with. So this all began on the last day of 2019 when the first cases of a new novel coronavirus were reported from China. And as of this week, so a little over 6 months later, we now have more than 11.25 million confirmed cases of COVID-19 across the world, and more than 500,000 people have died from COVID-19. So I think that's a great illustration of this rapid and devastating spread of this virus across the world. It's a respiratory virus, so it's spread by droplets, usually from coughing, sneezing, or even through breathing. This means that you catch it by being close to someone who has it. And the closer you are, the greater the risk of being infected. There's also evidence that people can be affected by touching hard surfaces on which the virus has been deposited. So cleaning and hygiene clearly very important here. Another important factor for us to remember is that people can have the virus, can be infected, and be completely without symptoms. So it isn't possible to tell just by looking at someone or for yourself as whether you've got symptoms or not, whether you've got the virus. It's also not possible to tell, looking back on the past months, about what symptoms you've had as to whether you've had the virus or not, because you may well have had it and had no symptoms. Those people who do have symptoms usually present with respiratory symptoms. So we're talking about a persistent dry cough, shortness of breath. They'll often have fever. And sometimes we're noticing people have a loss of taste and smell, the sense of taste and smell. Many people who have COVID-19 have a mild illness, but clearly some are much more severely infected and some will die. And so that's an understanding of the range of what we would call the presentations of COVID-19, from really practically nothing at all, right through to a very severe respiratory failure and death. We do know that a number of things increase the risk of people having a more severe illness. The people at the very greatest risk are those that have compromised immune systems. So these are people who may be on immunosuppressant drugs, for example, following an organ transplant. Also people who have sometimes have cancer, particularly blood cancers we know put people at increased risk, so things like leukemia. People who are having chemotherapy treatment, or people who have severe respiratory diseases pre-existing, such things as cystic fibrosis. But there's also additional risk for people who don't have quite such severe illness. We know that people over the age of 70 are at increased risk. We also know that people under 70 that have chronic heart, lung, kidney, or neurological conditions are also at increased risk, as are people who are seriously overweight. And by that I mean people with a body mass index of more than 40. There's been a lot of reporting about increased risk associated with ethnicity and socioeconomic status. The evidence at the moment is that these are likely not risk factors in and of themselves, but they are proxies for other factors that will either increase the likelihood of transmission, so the likelihood of you getting infected, they'll increase the risk of you having a more severe illness, or indeed they may negatively affect your ability to access healthcare. So these are more likely consequences of the role of socioeconomic status and ethnicity in severity of COVID-19. So an example would be people who are living in densely populated living conditions, people whose living conditions mean that they have many families co-living in one house. Clearly it's really hard to maintain distance and the likelihood of transmission is higher. People who are living in conditions where it's really difficult to maintain good levels of hygiene, that will also increase their risk of transmission, their risk of getting the infection. Populations that are known to have a higher incidence of chronic conditions, having already mentioned that that puts you at higher risk, clearly those populations would also be at higher risk of severe illness and at higher risk of death. So the relationship between these factors is complex and it's evolving and it's not linear. And so this is something that there's a lot of investigation going on about at the moment. And I think it's quite important for us to remember this so that we understand the real causes and effects and are able to tackle them. Currently, the only way to control the pandemic is to reduce the transmission of the virus. This slows the rise in cases and enables health services to be able to better manage and cope with those who are ill. It's really important, obviously, that healthcare is available for those who need it, and it's been particularly important in COVID-19 with the severe respiratory effects of the virus, where the availability of ITU beds and ventilators has been critical. And we've seen across the world how governments have taken different approaches to reducing transmission. Pretty much all governments have issued basic information around hygiene, frequent hand washing, covering of nose and mouth when sneezing, and so on. And almost all governments have imposed mechanisms for social distancing, so trying to keep people at a distance to reduce the likelihood of transmission, reduce the likelihood of infection. And we've seen that in varying ways across the world. So the Kingdom of Saudi Arabia, for example, had a series of curfews that stopped people leaving their homes for large parts of the day. I think at one point Dubai had a 24-hour curfew. We've seen governments restricting travel, and I know that in certain regions in India, the travel has been restricted between regions to try and prevent transmission. And indeed, in some cities, we've seen prevention of travel, prevention of people entering or leaving certain cities, and therefore hopefully containing the virus. And indeed, some countries have closed their borders. Australia has done that. Or indeed, if they haven't closed their borders completely, they've closed entry to people coming from areas that they consider to be at higher risk. And we've seen in China, for example, that some of the provinces have been completely locked down at varying intervals during the spread of this pandemic. So these are perfectly reasonable and sensible approaches to take, obviously, to control population movement. In addition to that, though, many governments have also issued advice on face covering, and some indeed are mandating the wearing of face coverings. This is another mechanism, again, to stop the spread and transmission of the virus. And as I said earlier, in terms of coughing and sneezing and even breathing, this can be a helpful addition to this sort of toolkit of things to help control the virus. Another approach has been isolation of cases and isolation of contacts of cases. So this is a sort of method of tracking and tracing people and a method of reducing spread. Symptoms or testing, or both, have been used to identify cases. Clearly, in a situation where you have asymptomatic people, so people that have the virus and have no symptoms, then testing is the more effective way. We're finding actually that having the virus without symptoms is more common than was originally thought. So the use of testing can be very effective. The approaches to testing is another thing that has varied widely between countries. The United Arab Emirates and the Kingdom of Saudi Arabia really led the world in embracing COVID-19 testing. They were carrying out tests on wide sections of their populations very early on. And in fact, in the UAE, by the 25th of April, they had tested over 1 million people. These tests are identifying people who have the virus. So they're testing for the presence of the virus in the individual. This then allows you to take the appropriate action, which is isolating them and keeping them safe and keeping others safe from them. In both the UAE and KSA, early and widespread testing enabled them to have a much clearer view of the extent and the pattern of infection, and therefore helped them significantly in their planning for disease control. And indeed, there were 2 localities in Dubai where they did door-to-door testing, and they carried out door-to-door testing, which really gave them a very effective method of localizing and containing the virus. So this type of testing, as I've said, which is testing for the infection, can be used alongside contact tracing. And this is proving to be very effective, this sort of double approach. So you test individuals. symptomatic or not, and find out whether they're having the virus. And then you ask them who they've been in contact with. And then you can either go and test those people, or you can impose some isolation on those people and really slow down the spread. Another type of testing that's available, which you may be aware of, is antibody testing. This is a different type of test. This tests whether an individual has mounted an immune response to the virus. In other words, whether the individual has been exposed to the virus or had it. I use the words mounted an immune response very intentionally, because it doesn't, or we don't know at this stage, whether it tells how much or how long a person is immune to COVID for, so the degree or the extent of immunity. And that's important because it's important for us not to assume that simply because somebody has antibodies that they are then immune and immune forevermore. As you can expect, there are lots and lots of these tests on the market. And the other important thing about all tests is that none of them are 100% perfect. And so testing should be used in conjunction with the other mechanisms that I've talked about, social distancing and hygiene and mask wearing and movement of populations, in order to best control this outbreak. I want to spend a minute on vaccines. Vaccines are obviously very topical at the moment, and there's a huge amount of focus on vaccine development for COVID-19. The pace of work on developing a vaccine for COVID-19 is truly unprecedented in medical history. So we've never seen people working in the ways in which they're working now to develop a vaccine for COVID-19. By that I mean that the length of time that usually we take to develop a vaccine is a decade or even more. You've got to create it, but you've also got to test it thoroughly, and that's critical. Fast tracking of vaccine development, the time frame for that is usually around 5 years. So when we know that people are, the ambition for COVID-19 vaccine production is 12 to 18 months, you can see that that's an extraordinarily fast pace of development and something that we haven't seen before. There are two primary goals in vaccine development, which probably sound completely obvious, but it's important to understand. So the first is that it's safe. If you're going to put a foreign body in somebody, then you really need to know that it's not going to have any adverse events. And you need to check also clearly that it works, that it's effective, that it will provide protection. And that's why extensive testing is so important. The other reason that extensive testing is important is we've got to know that it's safe and effective, excuse me, in the whole population that's going to receive it, regardless of age, regardless of other illnesses, regardless of drugs they may be taking. All of those variables have to be understood and factored into this. Of course, when we develop a vaccine, it's important, but it's only the first step. The vaccine has to be produced, it has to be distributed, and it has to be administered. And of course, it has to be paid for. And all of those are really important things to understand and to get right, and factors to consider when we're thinking about how quickly we might have a vaccine that will actually help people and make a difference in this. Currently, there are more than 150 vaccines in development, excuse me, and 19 in clinical trials, which is really extraordinary. And I think this is in no small part to the very unusual collaboration that we've seen between different pharmaceutical companies and across country borders in the development of these vaccines, people working together for a common problem that we haven't seen before. More than 10 countries are now involved in vaccine development, including China, the United States, the UK and Germany. In collaboration, as I've mentioned before, that hasn't happened. Of course, as I said, we are a way away from a vaccine. 12 to 18 months is our time frame at the moment, and that's for the development of the vaccine. It's not for, as I said before, the distribution and administration and funding and so on. And so I think there's no doubt that we will be living with COVID-19 for some time, both the condition itself, but also the consequences of the condition. I think the economic impact is very clear, and you'll all be very aware of that, but also the health impact that goes beyond the pandemic itself. And by this, I mean the consequences of people who are missing or delaying treatments such as screening, preventive care, therapeutic treatments for conditions that are not COVID and nothing to do with COVID. We also, of course, are managing and will continue to manage the mental health consequences, both of the pandemic itself and of the other conditions that are associated with it. And I think that these effects will be with us for many years to come. I'm happy to take questions, as I said, at the end, and I'm going to pass back to you now, Paddy. Thank you.
Paula, thank you so much again. I've been fortunate to listen to a number of briefings from yourself and the team, but you also get so much more information. It is an important reminder that this virus, the world has never seen before. And even though we're 6 months in, we're still learning so much more. And I suppose as a business, and some of the questions that we're starting to see clearly around implications such as our products and future pricing, it's really difficult as a business to anticipate what's going to happen next. We've seen many countries around the world come out of lockdown, but within weeks, sometimes a little longer, than having to restrict certain states, as in Australia, or certain travel restrictions, as in New Zealand, to prevent a second wave. So the uncertainty that comes with this pandemic is unprecedented. You also mentioned the vaccine and the trying to find a vaccine within remarkably short timeframes. As you say, history tells us that vaccines tend to be produced over a 10-year period, and we're asking the world to produce something within 18 to 24 months. So it is a huge global effort, but it's clearly in response to something that's so unknown and so unexpected and so unprecedented. We are getting lots of questions. One of the questions that we've had a number of times is whether this event is recorded. And yes, the answer to that is yes, it is recorded. Following today's webinar, we'll be sending out an email which will give details of how you can access that recording. So please feel free to share that with colleagues or indeed any of your clients. So moving on, I'm delighted now to welcome Rebecca Kett-Young. As I say, Rebecca is our Global Head of Operations, and we thought it'd be really interesting to share some insight in terms of how Bupa Global have been responding to customers during the last 6 months, and to share some of the changes we've seen in claims behaviour and indeed what we've continued to cover during this period. Rebecca, good morning, over to you.
Thank you, Paddy, and hello everybody. It's brilliant to be here with you today for our first live event, and it's brilliant to get the chance to talk to people that I've met over the years at various conferences and events. And normally, of course, we would be meeting face to face and at various glamorous events, but in the meantime, it's really brilliant to be able to talk to you from my spare room, and I'm sure many of you are in a similar situation. So I'm here today to share some insights of what we've seen so far with how COVID-19 is impacting our customers, how it's changing their behaviour and how it's affecting their demands for products and services. As the virus moved rapidly from east to west, we experienced a sudden change in consumer behaviour. We saw a sudden drop in claims, specifically outpatient benefit claims, as hospitals around the world closed to support urgent care only or COVID-19 patients. Since then, we've seen a steady month-on-month decline seen throughout Q1, with a sufficient drop-off in April post-shutdown, with a 53% reduction versus our normal March volumes and 65% reduction versus January. So we sort of look back now at January as the last time that anything was remotely normal. So it's become a real marker for us as to how we are measuring ourselves this year with volumes and things. In May, we saw a 36% increase versus April volumes, but we still had 50% of January's total volume. So it's the biggest reduction I've ever seen, because of course this is the biggest event that I've ever seen, where customers just fell away really. And obviously it didn't stop us looking for ways to support our customers, but the drop in contact was really significant. However, our customers did continue to access and claim for treatment during this time. As Sheldon mentioned, people still having babies, people still did need urgent care. And in some countries, the private sector continued as normal and was still accepting patients. So we really had a great mixed bag of reasons that people still needed to contact us. Customers continued to contact us for support, even though we saw, as I said, a huge drop in contact, and particularly in the very early days of the UK lockdown, which was around the middle of March, we saw almost no customers contacting us at all, which was a really interesting point and gave us, in a way, a bit of a space to get ourselves organised behind the scenes to continue to service our members. We offered support to a relatively small number of members who became seriously ill with COVID-19, so those that ended up in an inpatient facility, and all of those were case managed by our specialist teams and supported by our clinical teams. So rather than just paying the claims there, we really endeavoured to be a healthcare partner and look after those customers in that such a difficult time. And that was actually less than 250 customers. Obviously, you know, we would still be supporting customers as they come through. It's 250 at the latest count. So in Hong Kong and China, our pre-auth volumes began increasing month on month in March, whilst all other regions continued to decrease in March and April. And as the world started to recover, we saw different countries around the world re-emerging, and people are starting to access services again. All regions saw an increase in volumes in May versus April, although with the exception of the Hong Kong and China region, whose May volumes are now within 95% of January volumes, all other regions are still 50 to 65% down versus January. So we really turn our attention to what's going to happen next, and it's difficult because we really don't know. Just like all of you, you know, the future is a little bit uncertain, but it doesn't stop us planning to do what we need to. What we have offered during the pandemic, and you know, before that, but it's become even more useful during the pandemic, is our global virtual care app. More than 3,000 customers have now downloaded and registered for the app, which allows them to access doctors without putting themselves at any additional risk by visiting a traditional healthcare setting. And it's been a really popular tool, according to the feedback. We're also expecting to see additional costs coming through from hospital providers around the world in order to cover increasing PPE requirements and more in-depth cleaning measures, which does mean we expect the cost will increase for care and claims. We still have ongoing uncertainty, as I said, especially after the sudden spike of cases we have recently seen in Beijing after the easing of restrictions. Other countries could follow as they re-emerge at different rates. We've done some forecasting on what we expect. We're expecting what we call a claims bounce back at some point, and the picture is very much moving at the moment, but we are preparing for many customers to access treatment that's been delayed over this period. So the final thing I kind of wanted to end on is that how proud I have been of Bupa Global's people during this time. Many of them have had their own personal challenges, and it has been amazing to see how they've still been able to dedicate to their roles at this time. I think it's fair to say we all now know how reliant society is on childcare in its various settings, and many of our staff have had that challenge to face. But we've done many creative things, working unusual hours, couriering out equipment to people so that they can work remotely, and majority of our people have had the opportunity to work from home, which has actually worked really well. And we rolled out some brilliant call centre technology, meaning that phone calls could be taken at home as well. So despite the huge challenges we have faced operationally, which meant we've had to adapt our service model around the world, our service to customers has remained consistently high, which is, as I said, is a testament to our people around the world who put our customers at the heart of everything that they do. We saw a record score of 60 in our claims net promoter score in June, which we are incredibly proud of, as it was achieved whilst we were all still working remotely. This is up from an already impressive 53 in March and April and 57 in May. Throughout the pandemic, we've consistently hit our SLAs, completed our pre-auths quickly, and have been answering claims within 1 to 2 days. So that's all from me, and thank you so much for listening. I will be around for questions as well, so if you have anything that you'd like to answer, then just pop it in the chat box and I'll be more than happy to answer at the end. So Paddy, back over to you. Thank you.
Great. Thank you so much, Rebecca. Again, hugely insightful few minutes, just kind of talking about how Bupa Global have been responding over the last 6 months. I think it is important to highlight that, yes, whilst we have seen a drop off in pre-authorizations, we've continued to pay and support our customers during this time. I love the way that Sheldon refers to Bupa Global babies, but he's absolutely right. During the last 6 months, our customers have continued to have babies, and we've continued to support them accessing treatment for urgent care, such as cancer and heart conditions. Nevertheless, we have seen a drop off on claims, and it's trying to anticipate how long that drop off will last, and indeed what form of claims rebound we will see in the coming months and potentially years. Paula rightly highlights that there may be second order impact to this pandemic. We may see people develop conditions related to the pandemic or unrelated to the pandemic, conditions such as mental health continuing to rise, as we're starting to sadly see increasingly around the world. Rebecca also touched on the fact that our provider costs, the costs that we pay for hospital admission, we're also seeing those costs increase, as understandably hospitals put in place new cleaning protocols and new procedures to ensure that once patients go for treatment, that they are confident that the environment they're in is safe and doesn't pass on future infections. So lots as a business for us to consider, and indeed I know these recent events have caused huge interest from our actuaries and our pricing teams as we look about the impact of how the current situation has on our future products and our future pricing. But importantly, our business remains absolutely resilient. I think it's a testament to our people and indeed to the support that we have from intermediaries that ironically our NPS scores have increased during this period. We're exceptionally proud of the fact that our NPS scores are now around the 60 mark, which is probably some of the highest levels that we've ever seen. And again, underpins the fact that during customers at their greatest need, the Bupa Global and our partners are supporting them throughout. I'm pleased to say that there's been lots of questions over the last 40 minutes. So just to remind people how to ask your question, there is a Q&A function on your toolbar. It's indicated with a question mark. So if you haven't submitted a question, please do so. I'm going to pass over to the panel in just a second. If you have submitted a question, don't worry, I promise you we have received it. We are simply collating and we're not screening. So if there are any difficult questions, I promise that we will try and address those either on today's call or indeed as a follow-up. Okay, so let me just turn to some of the questions. Paula, a question for you over the virus and indeed some of the populations most vulnerable. Why are people with blood cancers more at risk than those with other types of cancers?
Thanks, Paddy. I think the first point I want to make is that what we're talking about here is at risk. So it's a greater risk of being more severely affected. What we're not saying is that this is definitely going to happen. So it's a risk of this. But the issue with blood cancer, of course, is that it is the blood in which the vast majority of the various factors in the immune system that fight things like the virus are carried. And so if you've got a disruption or an abnormality in that, then clearly that's going to mean that that immune system isn't going to function as well as it would otherwise. And your ability to mount what would be your natural defense against a viral infection is limited. It's not dissimilar to, it's not the same, but it's not dissimilar to the effect, for example, of having immunosuppressant drugs for the treatment of other cancers.
Great, thank you very much, Paula. Sheldon, probably certainly a frequently asked question. So can you share any information about the scale of actual COVID-19 positive cases that Bupa Global has dealt with? And what do you expect the impact to be on pricing?
Yeah, thanks, Paddy. So I think Rebecca indicated that at last count, we'd had something in the order of 250 live cases. Of course, we had a lot more calls and inquiries relating to the virus, but those were the cases that we were actively managing. And I think Rebecca said as well that they ranged from relatively simple testing to very complex ICU stays, in one case for quite a protracted time in the US, which as you can imagine is quite expensive. But that said, I mean, as it relates to pricing, we do expect the impact of even these relatively expensive COVID-19 episodes to be balanced out to some extent by a fall in claims elsewhere. But even if they're not, I think most of we have something north of £1 billion of premium across Bupa Global. So at this point, the impact of COVID-19 on our total premium base is relatively modest. So I think the short answer to that question is we don't particularly expect the COVID-19 pandemic itself to have a material impact on pricing, and we do expect it to be somewhat offset by claims that are either deferred or missed altogether from things like, routine treatment, dentistry, and that sort of thing. I will just pick up on something that Rebecca said, which is that, however, we do expect volumes to return. To the extent you might miss a dentist appointment and then wait for the next one. Obviously we are dealing with customers with musculoskeletal cancers, and a whole range of conditions that people may be deferring at the moment, and we're actively working with those customers to minimise that deferral, of course. But if they are deferring, that's all that's happening, and those claims will come back, and obviously we will look after those customers as they present. So at this point in time, it's a little hard to call the total impact of this, but it's not immediately clear to us that there will be a significant sustained downturn in claims in either the short or medium term.
Thanks, Sheldon. There's actually a follow-up question which I think is pertinent to that response, and that's in relation to the renewal of individual and group policies, so both SME and corporate. The question is that access to hospitals and specialists was not always easily accessible. Will the pandemic have an effect on premium rates? And alternative therapy and planned visits were on hold. Customers have also asked whether there'll be any rebate or reduction at renewal for their policies if they haven't been able to access them.
Yeah, so a common question that we're getting at the moment. So at the moment, as I said, it's not immediately clear to us the shape of the recovery. And if I can put it perhaps in terms of the financial markets, you may have all heard of the speculation of whether we get a V, a W, or an L-shaped recovery. And our view on, or our thinking on this is much the same with claims. So at the moment, it looks as if claims are bouncing back. So in other words, as private facilities open around the world, customers are returning with pre-auth and treatment planning. But that does depend where you are in the world. So at the moment, in the UK in particular, we're just seeing private facilities start to open. And of course, those facilities will have some backlogs. So in the UK, we expect it to take a little longer for our Bupa Global customers to potentially fully re-engage with the healthcare system. In other parts of the world, that re-engagement is happening as we speak. So I'm afraid it's a slightly tricky answer in that it does depend, and it will depend on location. It will depend on the type of treatment the customer was having at the time, and also, if they've had a diagnosis within the pandemic window, how they've dealt with that. But as I think I said earlier, health insurance, and particularly with Bupa Global, is a long-term investment, and we suspect that our customers are maybe deferring treatment, but we are certainly encouraging them not to elongate that deferral. So it's not immediately clear to us there will be a significant fall off in claims in total during the course of 2020. And we also have, as I think Paddy alluded to, some concerns about the capacity for private hospitals, what that will do to pricing, and of course the additional costs of personal protection equipment, cleansing, etc., etc. So we will be working with each of our customer segments, be that corporates, SMEs, or individuals, and trying to come up with the fairest answer for everyone. And I think that will be the approach we'll apply to this. We are not expecting this to be a good news bonanza for Bupa Global. We are expecting this to be a managed event over the course of the next year, where customers and their loss ratios and the value they get from the product are something they can be happy about.
Thanks, Sheldon. I mean, I know that's been a particularly frequently asked question, particularly in those markets that Bupa Global also share with our domestic businesses, and some of those domestic businesses have made commitments around some form of financial rebate. And it is an important point to underline that actually the products and the segment that we're in is fundamentally very different. We cover much broader range of benefits than some of our domestic businesses, and therefore the ability to make the same commitments isn't always analogous. So I think that's a very interesting point, that what we might say for our domestic business is fundamentally very different to what we may say for Bupa Global, but our priorities remain to our customers. We will always be fair and transparent with what we do, and I think that demonstrates the fact that ultimately we don't have shareholders, and we will always ensure that we do the right thing for our customers. Paula, lots of questions coming back regarding the virus. One particular interesting one is around whether the virus may mutate, and indeed what impact that might have in any vaccine that has been developed or in development.
Thanks, Paddy. Viruses mutate all the time, and we're very familiar with that because clearly that's the basis of why the flu vaccine is an annual event and not a sort of one shot and you're done for life. The genome of this virus was mapped in China very early on in the pandemic and shared globally, which has enabled the very quick movement on development of the vaccine. And it's also been monitored. And so we have already seen mutations in this virus. What we have seen, though, is that the mutations that have happened have not affected the behaviour of the virus. And so the vaccine development is still on track. But the short answer to the question is yes, it is possible that the virus will mutate significantly, and then vaccine development will have to sort of rethink or do a sort of sidestep or whatever in order to make sure that the vaccine is effective. But yeah, we have to do the best we can and deal with the circumstances that we have.
Thanks, Paula. Rebecca, a question for you. What are your expectations regarding the people that had to suspend treatment? Do you expect a higher increase in the insurance consumptions in the near future due to the suspension during the virus period? And if so, what are your perspectives about this, and what are the timings expected for that increase?
Yes, thank you, Paddy. It was one of those times really where you wish that somebody could invent a crystal ball and tell you exactly what's going to happen, but we're certainly using all the facts at our disposal and as much insight as we can to think about when it is likely that each region and each country in some situations will start to claim at normal levels and perhaps more than normal levels again. Best guess at the moment is that it will either be towards the end of this year or the beginning of next year, and we're planning our resource accordingly. So we want to be ready to be able to pay those claims as they come through, support those customers with clinical support and case management. Most customers have had treatment delayed, not cancelled. They will need to have that treatment again. Some treatment had to go ahead, and some treatment, I guess, would have been taken in the public sector, depending on the country you're in. But we do expect a pretty significant increase in claims at some point, and we factored that into obviously our financial planning as well as our resource planning. At the moment, it's not clear, but as I said in my presentation, the volumes are getting up towards normal levels. So, to a degree, that's our first challenge, is to cope with what normal volumes are coming through with the various different situations that we find ourselves in, and then after that thinking about when any increase comes. But as I said, we think it's going to be later this year or perhaps early in 2021.
Thanks, Rebecca, that's very helpful. Sheldon, a question regarding actually not so much the virus but our customers' ability to pay. You rightly highlight that that there is similarities with how this virus changes and develops in the same way that the economy equally will experience some form of downturn. And indeed, many of our customers are speaking to us about what they can do regarding renewal. What can customers do if they are experiencing financial difficulties?
Yeah, so thanks, Paddy. So we did put a couple of extra measures in place, but in reality, we already have processes and protocols for dealing with customers who are having premium payment difficulties. So I think the simple answer there is we've simply extended and re-energized those existing protocols around our service team so that people are sensitive to the issue and have quick access to some resources to help them with customers. I mean, I will say that we've had relatively low levels of inquiry around, let's call them ability to pay questions, and obviously far more around, what am I covered for? Will you cover the pandemic indefinitely, et cetera, et cetera. So at this point, it doesn't seem to be affecting our customers' ability to pay, but I'm also very conscious that the likely longer term fallout of the virus is economic. And that will affect all of our customers to some extent, but I suspect it will affect them in an imbalanced way depending on where they are and who they are. So I think what I'd say there is if your customers are experiencing financial difficulties, we are willing to have those conversations and to support those customers through this. But we can't issue a blanket statement on it, because, as I said, it really depends very much on where they are and their circumstances. But we are open to those discussions and are having some. But as I say, those inquiries have been fairly limited to date.
Great, thanks, Sheldon. Paula, a question for you. You mentioned during your segment that there were kind of potentially second-order impacts of the virus, and indeed during this period, a number of people have had to self-isolate, they've had to shield, or they've had to spend long periods on their own. What impact do you think this virus will have on people's mental health, both in the short and longer term?
I think there are plenty of reports actually now, Paddy, and plenty of evidence of a significant impact of the virus on mental health. And I have to say, it's not really the virus's impact, it's the impact of the actions that have had to be taken to contain the virus and the consequences of that. So we're really talking about the mental health impacts of being isolated, being limited in ability to do the things that people would normally want to do, and to do those things that maybe many of us use to sort of decompress from daily stresses and so on and so forth. So I think that there's absolute clear evidence that there's going to be a mental health burden as a consequence of COVID-19. I think it'll take different shapes and forms. I think there is a sort of reasonably short-term impact, which is related to stress and anxiety with dealing with the daily constraints and daily living. I think there will be people clearly who have been very seriously impacted, either themselves or with relatives who've been seriously ill or unfortunately have died. And there will be the consequences of the mental health associated with that, and bereavement, and maybe some other mental health feelings that go alongside that. And for those people that are involved, even from a reasonable distance in the provision of care. And when I say distance, there's been evidence that shows that you don't actually have to be involved in hands-on care, but you're involved in some way in the organisation and the delivery of care, then you can have a severe mental health consequence of that in terms of the trauma, if you like, the mental trauma of having to cope in these very pressured, difficult and challenging times. And that sort of impact, that mental health impact, can be delayed. And so I think what we're looking at is the acute issues now that will move into more longer term issues that will go on, as I say, for well beyond a year. Because in those circumstances where there's been a significant event, then often what you have to wait for is the anniversary of that event. You've got to get through the anniversary, remember what we were doing this time last year and what the consequences were, before you really can begin to thoroughly heal and get better.
Thank you, Paula. I mean, it is one of the worrying trends that Bupa are seeing across our different businesses, is that the increase in mental health and just how indiscriminate mental health and poor mental health is, kind of irrespective of who you are in society. We all experience poor mental health, and I think it's worrying that this pandemic has added to that burden. So we will certainly be sharing more in forthcoming events. So unfortunately, that draws us to the end of the hour. A massive thank you from me and the panel, and indeed everyone from Bupa Global. We want to say a huge thank you for joining us today. Hopefully you found our first Perspectives event helpful, and that it equips you with some more insight to speak to your customers, and indeed to speak to any of our account managers. I want to conclude just by reiterating how much we value our relationship with our intermediaries. Today is the start of our new series, and it signifies, in our eyes, the start of a new chapter, a better, stronger partnership where we increase our engagement with you and how we communicate with you. We want to boost your knowledge and expertise by giving you better insight in terms of the goings on within our business, and giving you access to experts within Bupa and externally. Ultimately, we want to work with you to grow our relationship and to help you grow your business. The plan is for these events to be regular, so watch out for the next session, which is planned in September. We'll also be sending out feedback after a feedback survey after this webinar, so please do take the time to give us your feedback. It will be central to how we develop these webinars over the coming months. Until then, a massive thank you from everyone at Bupa Global. Please stay safe and stay well. Thank you.